At the age of 57, Mr. Paul Davis, who is on hypertensive medication, has arrived at the pharmacy. Over the past few months, he has been complaining about tremors in his right hand. He was referred to a specialist within 6 weeks. At the specialist, he was diagnosed with early stages of Parkinson's disease. Blood tests were taken and further appointments were arranged in 3 weeks.
Hi, how can I help?
Hi, my name is Paul. I'm supposed to be the pharmacist.
Hi, she's just in the consultation room. I'll just check if she's free.
Alright, thank you.
Okay?
Yeah, that's fine.
Hi, if you could just go through, that'll be fine.
Thank you.
You're welcome.
So I understand that you've actually been diagnosed with Parkinson's disease today. So how was your visit to the specialist?
It was a bit daunting and quite scared, to be honest, because you don't want to be diagnosed with Parkinson's.
Right.
And he says I've got early stages.
Right.
But he also said I don't need any medication for now. Why is that?
Basically, when you get treatment for Parkinson's, you get treatment for when you're actually experiencing the symptoms. So at the minute, you're not experiencing bad symptoms, are you?
No.
So therefore, it wouldn't be beneficial for you to be put on medication now.
Right.
But normally, people that have been diagnosed with Parkinson's, within about 2 years, they might be starting to take medications because their symptoms might have got worse. Yeah, and here's a leaflet about Parkinson's. Have a read through it. If there's any questions or anything you don't understand, come back in or give us a call. And
Thanks. Yeah, he's given me all this information about Parkinson's, so this will answer it, but could you just explain it to us, because it just went over my head.
right, basically, in our brains, we have something called dopamine.
Okay.
And basically, dopamine is involved with movement and speech.
Right.
But basically, in Parkinson's patients like yourself, you start to get a lack of it in small areas of your brain.
Yeah.
So that's when like your movement and your speech might start getting slightly affected.
So is that why my hand's shaking in the evening?
Yeah.
Right.
But it's not bad at the minute, is it?
No, it's just, it comes and goes. When I start using it, it stops, but when I rest it again, it starts again, it just shakes.
Yeah, but just keep an eye on it. If it starts affecting your daily activities, then I'd go see a specialist again.
Okay.
Okay.
Yeah, thank you.
Now, at the age of 60, Mr. Davis has come back as his symptoms have become worse and the doctor has given him a new prescription.
My symptoms have become worse and sometimes I can't control them. Doctor's given me levodopa.
Levodopa, yeah.
Yeah.
Right.
Well, what is that and what does it do?
Do you remember last time we talked about how Parkinson's patients have a lack of dopamine?
Yeah, when you talk about my hand shaking.
Yeah, so
Yeah.
basically levodopa is actually converted to dopamine, so you actually have a bit more dopamine to actually help control your movements and your symptoms, so hopefully it'll improve your symptoms. So at the minute the doctor's actually prescribed you the lowest dose, so hopefully it'll manage your symptoms. But if you keep thinking you can't control your movements, then go back to your doctor, okay? So, but some people, not everyone, but they do experience nausea and vomiting, so it's important that you do tell your doctor when you go back for your next review. Do you have any concerns or anything?
So are you gonna put the dose up, or is it
If
just...
it's not working, if you're finding you still can't control your movements, then
Okay.
we'll alter the dose of levodopa. Okay, but
Yeah.
remember to monitor if you have any nausea or vomiting.
Right. I'm getting a bit of a dry mouth. Is that if I have a glass of water?
Yeah, help yourself.
I'm sorry.
Oh, it's okay, I'll wipe it up later.
Now, at the age of 60, Mr. Davis has come back as his symptoms have become worse and the doctor has given him a new prescription.
I'm a bit confused. I've got a new prescription for course something or the other.
Right, co-cardopa,
Yeah.
I think, right.
Yeah.
And what, do you just want to understand what it is?
Yeah, what it is and what's the difference and what do you want me, like, what should I do with it?
Yeah, alright. Okay, basically this new drug will basically help maintain your dopamine levels. Remember last time dopamine?
Yeah, with the hand, yeah.
Right, and basically with your old drug that you were on a few years ago, levodopa, we're going to reduce the amount of this, so you're going to be starting your new drug now.
Right.
Remember, always monitor your nausea and vomiting. Preferably take it after food to help minimise the side effect.
Okay.
But if the nausea and vomiting is still like a continuous problem, go see a doctor. Maybe they'll give you something for the nausea. But not everyone gets them, but just keep an eye on it, okay?
Alright, thank
If
you.
you have any concerns, just come back whenever.
No worries. Thank you.
Mr. Davis returns to the pharmacy 10 years later at the age of 67.
Dave?
Not really. My symptoms have got a lot worse and I just can't control them anymore. Whenever I take my dose, it starts to wear off so early that by the time I get to my next dose,
It's not working.
it's just not working.
Right, okay. Well, actually, the doctors actually increased your co-carbidopa, so hopefully this will help in some ways. But you might actually want to try and discuss with your doctor about maybe a modified release tablet. And basically this means a longer lasting tablet, so instead of it only working for a short period of time, which you're experiencing, it will actually work for a bit longer. Okay. So it's like a sustained release one. Or maybe you might want to discuss with your doctor another drug that could also help. I know it's a lot of drugs, but maybe a mantiledylene.
What would that do?
Basically, all these drugs that for Parkinson's is basically to do with the dopamine anyway. Just basically keep it on the highest level as possible. Okay.
At the age of 68, he is now suffering from depression.
And depression is actually quite common in Parkinson's patients. So basically the doctors actually prescribe fluoxetine, which is basically will help with your mood and keep it stable. Did the doctor tell you this?
Yeah.
And did he also warn you about stopping siledylene for 2 weeks before starting? Because it is quite important that you do not take it for 2 weeks before starting fluoxetine.
Alright, okay. He said something about...
Do you want me to write you a note, just in case you remember?
Yeah.
A year later, Mr. Davis suffered more dyskinesia from the effect of levodopa. The effect of levodopa wears off generally after 8 years. He was given amantadine to treat this in tablet form. At the age of 73, the patient has now very poor control of symptoms, which are severe and disabling. He is unable to attend the pharmacy, therefore the pharmacist has suggested amantadine to be injected subcutaneously. This administration is more effective than tablet form due to avoidance of first-pass metabolism. This type of administration is only available at specialist centres. He suffered extreme vomiting, which then prompted the prescribing of domperidone orally for at least 2 days after the injection.